Hello everyone, I'm your show host, mental health aficionado Utkarsh, NLP certified practitioner and an artist. And today at Good Mental Health, we are continuing our revolution with Disorder Dialogue Series 2022, for which I am having with me psychologist Anuradha, who is the founder and director of Good Mental Health, RCI licensed mental health professional, a professional adoption counselor, podcaster, life coach, and an international radio show host.
So, hi Utkarsh. Firstly, thank you
Hi,
so much
hi,
for
Bob.
this. Yeah, hi. So, thank you for this wonderful introduction. So, quite excited
The
to start
pleasure is
with this
always
session.
mine.
Yeah, that's great. So, happy to be starting DD2 here today. We are going to talk about anxiety. So, the audience who will connect with us, I'll be happy to answer their queries, and I hope they are going to get something from this today's episode. So yeah,
Indeed,
thank you. Over to
indeed,
you.
indeed, we all will. And thank you so much for having this DD2 being happening. Now, this is to inform all our listeners and who will be joining us in upcoming time and who has joined us right now that all your anxiety related concerns and queries and questions will be sorted and responded to by our psychologist Anuradha. In the last section of our wonderful session, which we are having right now, and you can write down your queries, your questions in the comment box below, and one by one it will be sorted at the end of the session. Till then, stay tuned and stay connected with us at the last of this till the last of this workshop. So let's begin with DD2 anxiety. Share with our audience what is the exact understanding of anxiety. Though.
So okay, let's begin with explaining you what is anxiety. So I'll take you to my slide for a better understanding. Yeah. So when we talk about anxiety, that's basically a mind and your body's reaction to either a stressful, maybe a dangerous, or very unfamiliar situation that a person experience. That can be very uncertain and in which a person feel a kind of uneasiness, a lot of terror, or you can say a dreadful situation or fear that is being generated. The person instantly feel that there is some constant worry, a lot of nervousness also a person feels about it, and that gives a very uncertain result or outcome. So that's what is called anxiety, and it is actually a very deep subject to be explained, and it has a lot of types. So as any disorder, when we talk about, it has their own types, and everything, every whatever a person is experiencing in terms of emotional health concern, where we consider anxiety is also a disorder, emotional health concern, wherein I told you that it is a very deep subject. So it has its types. I'll be discussing each one by one, starting from the first, that is GAD, also called as generalized anxiety disorder. So in this, again, a person experience a kind of anxiety that is excessive. So the person experience very uncontrollable worry. Also, that can be due to any activity or event that is going to happen or might have happened into person's life, or that can be ordinary as well as can be of routine life, right? So that affects the person how they feel physically. And the
Right.
person constantly keep on feeling very anxious, also worry, and that hampers the person, actually distresses a person. And this thing, when it is happening continuously in somebody's life, it actually can lead to anxiety disorder, also depression. So symptoms of depression can also be started, right? So this is what anxiety is. And this is one of the types. So there are a lot of other types. Now we'll be discussing about the panic disorder. So when we talk about the panic anxiety, when anyone is experiencing panic, symptoms. So what exactly happened is this is here the person feels a kind of sudden panic symptoms that are generally out of the blue, and there is no particular sign, and there isn't anything that specifically triggers that thing. But sometimes there are constant, persistent, or very, you can say, lingering thoughts that are already in the mind of the person. So these things are already related to the past of the person. They don't want to come, in the mind of the person. They don't want to come,
Hello, dog, your voice is trembling in between. So can you please repeat panic disorder?
Can you hear?
Is trembling in between? So can you repeat panic disorder again?
Can you hear me?
Now it's audible. I can hear you. Can you please repeat panic disorder once again?
Okay, yeah. So when I'm talking about panic, that basically a sudden panic attack a person feel. There are the symptoms where, which is wherein the person feel excessive anxiety that comes out of the blue, and there isn't any specific reason for those triggers. But definitely that has been experienced by a person in the past. So they fear that those things should not come back to them. So out of that fear this thing happens into their life, and there are sometimes expected and unexpected reasons for it, and that stays in a person for a few minutes, or maybe lasts for an hour in some cases, not every time. Usually it is for a couple of minutes, but then in case of a severe anxiety attack, few people experience and have shared that they continue to experience it for an hour, right? So this is panic disorder, and which is again the type of anxiety. Moving on to the another, which is post traumatic stress disorder. So now when we talk about PTSD, so basically it is a very well known kind of anxiety disorder, which is related to either trauma or stressor. So, what happened is when somebody has experienced a traumatized situation in their life, either they have lost somebody, have met a car accident, or maybe struggling or having a battle time in their life, or maybe may have become the victim of some violent act. So, anything that has created a traumatized experience in the person's life, that's what then cause anxiety in the person. This is one thing. And when I'm talking about stressor, stress which is extreme in level, when somebody has experienced or gone through maybe a divorce situation, or maybe a separation thing from a loved one, also when there is a beginning of new venture in somebody's life, that also cause a lot of stress in somebody's life, right? And when you're trying to move on in life, so these situations when it gives you a lot of stress, so that's what gives the anxiety to the person. And now when I'm talking about PTSD, which I told you that it is related to trauma as well as stress, when both of the things have been really hampering you a lot, that's when you feel anxious. And this may lead to acute stress disorder, also may lead to adjustment problems in the person, right?
Right.
Yeah. So that's post-traumatic stress disorder. But the another type of anxiety. Now we'll be talking about OCD, which is obsessive compulsive disorder. So when we talk about obsessive compulsive disorder, so it is basically characterized by obsession and compulsion in a person. What happens is that there is a constant thought that is repeatedly happening in the person's life, wherein the person has no control. Right? Give me a second.
Sure, sure.
Yeah. So there is this constant thought and an image, or you can say a picture, that is continuously coming into the person's mind. So this is why the repeated things are happening into the person's life, and which is out of obsession happening. So this causes a lot of distress in the person's life. And now when this thing is happening too much, the person needs to ease themselves, right? So to elevate
Right.
that, out of compulsion, they do or perform that task multiple times just to find out ease, right? So this is what is OCD, wherein there are a lot of obsession, the multiple or repeated thought processes happening, continuously one thing they can picturize, imagine, and can see, and that is being followed by, or the person is compelled to do certain actions repetitively. And this isn't it. OCD again has its types. Definitely, OCD is a type of anxiety disorder, and it has another types. So whenever somebody is experiencing or going through OCD, so they'll be definitely going through either of these. I'll just mention. So these are the types of OCD. One is contamination, other is checking, the another one is intrusive, and the last one is hoarding. So when I'm talking about contamination, here the person experience a kind of fear of being contaminated by something that can be of germs or something, right? So the person keep on either washing their hands or keep on bathing themselves. They want to be free from anything that is contaminated. So they have this anxiousness, continuous fear. And another type is when somebody is experiencing, that is checking anything that can be checking off your fire burner, if your gas stove is off, if your geyser switch is off, if your electricity switch is off, any of the switches, or maybe checking off the door locks, right? If you're leaving the house, few people keep on checking, if the lock is really been done, or there is another constant worry. There are people who do put things in a systematic order. They keep on organizing things. Maybe that can be shoes in the floor. They want to just put it in a symmetry. They don't find it, in a nicer way. They always feel that, there is a urge from within themselves that they want to just organize things, right? So the another one is intrusive thoughts, where there are continuous or repeated number of thoughts coming to a person's mind, which can be very horrifying, either upsetting to a person. So what happened is that these are the thoughts definitely that is going to be very negative to experience, and when this happen continuously, the person tend to feel anxious. Right? This is another type of OCD, and moving on to the last type of OCD, which is hoarding. So if ever you have come across with a person who just feel very uncomfortable to be, throwing away their worn out items, something that they have, maybe that can be clothes, shoes, anything. So which they don't even want anymore, but they can't get rid of it, right? So when somebody is experiencing this thing, and when it is hampering their life also, then this definitely is a disorder, right? And there isn't any attachments with that thing, but there is a fear of lot many things altogether, right? So these
Okay.
are the types of OCD.
Doc, Doc,
Yeah,
I want to ask one thing.
sure.
If a person going through OCD, and as
Mhm.
you mentioned, these are the types which a person experience during that phase. So that individual, can he or she have all these at one time?
No, 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 no. Depends. There can be all of these
Okay.
four together. There can be two things together. There can be
Okay.
three of the types of OCD together. And there can be in one or two types of anxiety disorder also. So there can be multiple things altogether. It is not like only there is going to be one. A person can be having a fear of a specific thing. Also, they have, OCD along with that. So the anxiety is there, which is about the specific thing, including the other type of anxiety disorder, which is OCD. And in OCD also, there can be any of the type which the person has, right? So
Okay.
there isn't any in particular thing that if there is one disorder, so the person cannot have another, or maybe if going through one, can't experience the other thing, right?
So in that case, if the individual is having more than two or more than three, so
Mhm.
it will be considered a comorbid situation and a higher mental health condition and concern which a person is going through, right?
Yeah, it can be considered higher only when the intensity has been, very
Okay,
high. Depending
okay,
upon when we just go through the assessment, that is the reason why we take assessments. So
right.
assessments actually assure us that what is the level of that problem the person has. So when we get to know,
Mm,
that's when we can decide if it is on a higher side or a lower side, or the person is experiencing just to a moderate level, right? So when it is on a higher level, definitely that needs more attention, that needs number of therapeutic session, and when it is really a severe case, then we need to involve medication as well, right?
yes, true. Thank you.
Yeah. Okay, so moving on to the another type of anxiety disorder, that is social anxiety disorder, also called as social phobia. So, when this is happening to anyone, they have an excessive fear or anxiousness, for any crowded situation or in a social situation. They tend to avoid those places. They tend to avoid the social gatherings, even. Why? Because they continuously fear that they might be judged by somebody. Maybe they will be viewed by somebody in a negative way. There will be embarrassments that they will face, or they already have a self consciousness with them. Fine. So this is a disorder. If it is hampering somebody and hampering for a longer time, then definitely that need professional attention, right? So this is the another type of anxiety. Moving on to the next one, which is separation anxiety disorder, which we also call it as a childhood disorder. Why? Because that generally happens in children. So what happened is that when a child is being separated by a parent figure, or somebody who is parent to the child, also when somebody who is playing a parental role to the child. So why? Because there is a lot of connection the child has, a bonding that the child has with the parent. And now when due to any reasons, maybe when the child is being sent to a boarding school, or maybe for a few days parents are out of the town, so this cause a kind of severe anxiety in the child cannot manage with this. And there is a persistent very high level of anxiety the child face, and this can actually hamper the child's life in daily routine also, and in their studies, in their work, also in their schooling, and in the social situations also. So this can really hamper, right? So that is the childhood disorder. Moving on to the next type of anxiety, which is agoraphobia. And that also is a type of anxiety in which there is an intense fear, very excessive anxiety a person goes through it or experience. That does happen because of, a place or situation wherein the person keep feeling that, they have a fear of, maybe they can get trapped into somewhere, they can get helpless, wherein they can't escape from that situation or from that place. So this constant fear makes it very uncomfortable for them to be moving out of home. So what these people try to do is to stay at home and do not go anywhere alone. So they try to just stay at home and avoid places, or avoid going or traveling alone in car, maybe in buses or trains or in airplanes, or going to any crowded places just to save themselves, right? So moving on to the another type, which is selective mutism. So that is again a childhood disorder. So what happened in this is that there is a consistent failure the child feels, or faces to it. It happens when they have to speak in a particular situation, but when they are not being able to do that in a particular situation, maybe the child is good at home, right? He's very talkative, she's very talkative, but in any particular situation the child becomes completely mute. But there is definitely a reason behind it. There can be a fear factor, there can be something has happened with the child, because of that this is what the child is doing. But this is a situation where the child constantly feels fearful, or anxious. And this again can interfere with the child's life drastically. It can really hamper the quality of life. It can hamper with the schooling, with the work, with the social situation. So, this type of anxiety needs a professional attention too. Moving on to the next one, which is a specific phobia, right? I already explained about the social phobia, wherein the person tend to avoid the social gathering because of they have their own fears of being judged or viewed by others. So when I'm talking about specific phobia, here the person has a specific phobia for an object, maybe for a situation. So they tend to avoid that. So when somebody gets into this situation, so it can provoke panic attacks in some people. So this is again a very dangerous situation that need a professional attention, and that also cause a major or you can say excessive level of anxiety. And moving on
Mm,
to the next one. Yeah, please.
right, right.
Okay. So moving on to the next one, which is substance induced anxiety disorder. Now, this is very much related to any substance, right? So, which is being characterized again with a very high level of anxiety. It can even lead the person to a panic attack also. How does it happen? Either to with the direct result of use of or misuse of drugs, or by taking any drugs or medication, or when somebody has been exposed to a very toxic substance, or when there is a withdrawal period from the drugs. Maybe somebody is on a drugs for a very longer time, and now suddenly the drugs have been stopped, right? So when those medications are being stopped, so the person starts to feel a kind of anxiety, and that too is very, very high, right?
Right.
Yeah. So these are the types which I just discussed with you, and about anxiety, which I told you that it is a very vast subject. It has types, and in the types also, in one of the type, it is again with number of types. So I hope the audience is now clear with the number of types. Whenever there are symptoms like whatever I explained about the situation, so that is what they might be going through.
So, as anxiety has various layers, which are right now told by you, uh, so it becomes essentially crucial to be vigilant about each of them. And now, which are the signs and symptoms and the distinguished features of anxiety that demarcate anxiety?
Right. So basically, I shared with you the types. Any type when somebody is experiencing, definitely all the anxiety types have certain physical, behavioral, and cognitive symptoms. So there are definitely symptoms that actually informs the person or conveys the person that there is something happening with them, either in form of physical symptoms, behavioral symptom, there are changes in the behavior, or the
Right.
cognitive symptoms. So when we
True.
are talking about anxiety, so I'll share the symptoms here, that the person goes through a lot of nervousness, or there is a jumpiness that the person feel. There's a lot of restlessness also. When in anxiety person feel there's a trembling, there is a shaking, either can be of hand or body, right? So few people when they experience a panic attack, their whole body tends to shake a lot, and there's a feeling of tightness in the pit of stomach or in the chest area. And when somebody is experiencing, the physical symptom, when somebody is experiencing anxiety, the physical symptom that they show is there's a lot of heavy sweating they experience. They get sweaty palms, also they feel faintish, literally, like they feel lightheaded. And the other features are they feel that there is a dryness in their mouth and throat. If somebody is experiencing suddenly some anxiety thing, right? So what happens is they start to feel that there is some dryness, they can't speak, right? And there is a shortness of breath. Also their heart starts to race very faster when this has been happening with somebody. So this is a sign of anxiety. Also the cold fingers, and when somebody is having upset stomach and feeling of nausea. So these are all the physical features or physical symptoms when it does happen when somebody is experiencing anxiety. The next is
Yes.
Yeah, moving on to the behavioral symptoms. Whenever somebody is experiencing anxiety, they will avoid, a lot of things in life. They will show a lot of avoidance behavior. They will become so clingy, dependent because of the fears they have in life, or the anxiousness. They don't want to face it, so they tend to become very clingy. They become very agitated as well. So these are the behavioral symptoms. Moving on to the cognitive. So in cognitive, so they constantly feel a kind of worry in their life. There's a lot of anxiety they feel, nervousness they feel, that is always about the future. That thing might have not happened, but because of their past reasons, they keep constantly fearing about their future.
Yes.
And yeah, so also there is this constant, feeling of staying alert with the bodily sensation. They become very sensitive with that. They always have a fear of losing their own control about the certain situations. That can be about anything. Also, there is a very intrusive thought pattern they start to develop. They keep on thinking which is not in their control. So they have this nervousness to be thinking again and again. They'll always stay confused. Their thoughts can never be straight. They will think totally in a confused way, right? They can't make any decisions. So they find it very difficult to be concentrating, to be focusing on something. And they feel that, they are literally on the edge. They can't get a control of what they are thinking. So these are the cognitive symptoms. Along with that, I would want to mention that whenever anyone is experiencing any of the symptoms which I mentioned, either of cognitive, behavioral, or physical, that can in generally also happen to anyone in any point of time in life. We do experience sometimes, I think, quite a lot of things in life, right? But that is not a serious affair until we are, experiencing it more than the days, or number of days, or maybe if it is converting from days to weeks, and when it is converting from weeks to months time. So that's when it is a serious affair. One needs to take, care about it. Yeah.
Yes. So, admirers and listeners have to be precisely aware of these symptoms to not get cuffed with anxiety at any point of time. So, now is the time to bring in forth the case of anxiety that you handled off.
Yeah. So, well, I can think of one of the case, and I would like to share. So, this was a case of a girl, young girl. She was 19 years, and she was a dropout from, her, the regular studies, because of she was actually experiencing anxiety. And until she came to me, she was not sure what exactly is her situation, what is she going through. And her mother was so much distressed. She was very, very stressful that what is happening with my child. She was unaware about her situation, what her child is going through. And she was upset with the girl as well. And there were a lot of conflicts they all were having within the family because of what this girl was experiencing. So what happened was, when they reach out to me, and I just tried to have the case intake, wherein I found that she's experiencing anxiety, but I had to be more confirmed. And when I started with, the whole thing of counseling, so I realized the mother also need a lot of attention, wherein I psychoeducated her. I did some counseling sessions to her also. And the girl was experiencing anxiety disorder also, in that the she was experiencing the type which was OCD. So now in OCD also she was experiencing the hoarding, also the intrusive thought pattern. And because of all of these things, she was just literally on the edge. She was not able to find out why things like this is happening with her. And the mother was upset that why she can't really get rid of her old stuff when she doesn't need it. Why is she keeping it? So that's when I just conveyed that this is a disorder she's experiencing. You need to cooperate with her. You need to maintain patience. Also, first, you need to understand that your child is not well right now. So that's when, yeah, she was aware about the situation, and she conveyed it to the whole family. And because there was a lot of restlessness, because the whole family was also not cooperating with this girl. She was already in a mess because of her disorder, and now the family was not able to understand. So this was the thing which was happening, and that's when I started with the
Okay.
intervention, gave her a couple of sessions. She was very calm in I can see few couple of sessions, and we continued until she was out of her distressful situation what she was experiencing. So this was one of the case, and she's now doing well, and I don't know presently what is she doing, but then at that point of time I still remember the last session. She was so calm, her mother was happy, she was very cheerful. They both experienced that, and actually they accepted what the situation is. So only thing is, when somebody is experiencing something, it's important to be get diagnosed. And once you are being diagnosed with anything, take the right intervention, because that's what will make your life beautiful. So when they prioritize their emotional health concern, that is why, that is how I could help her out. So yeah. So this
So,
is
firstly, it becomes important for the individual who is undergoing anxiety to be seeking and taking a prior
absolutely.
mental health professional aid and care. And here, the same this girl did.
Yeah, absolutely. So this is
And
important. I,
secondly,
I really believe that everyone should prioritize their emotional health concern. I think in my all sessions and everywhere I do say about it, that everyone should prioritize their emotional health. And it's not something that that if you think that your physical health is to be paid attention. So emotional health is equally important. So focus for
mm,
that.
because I believe that personally, emotional well-being is something that leads to the another health to be taken care of, like another aspects of health, which include physical, financial, social. So it
Hmm.
combines everything all together in one. That is the emotional health and the well-being.
And there is a very beautiful definition also, that there is no health without mental health. I forgot
Yes,
that, yeah, by whom it is, but then it
indeed.
is a serious thing, that there is no health without mental health. When you're emotionally stable, you're mentally sound, that's when you are healthy. Otherwise, you can't do anything for yourself. You can take care of your body if you're emotionally sound. If you're not, of course, your body will be facing a lot of things. So it starts from just one thought and can lead to so many things.
Correct. And secondly, it becomes mental health professionals' prior importance for taking care of the people who are undergoing emotional health concerns and ailments. And it's because of your top-notch zeal that this girl could be taken care of and her condition got better. And hats off to you for always being there for people and helping them in their emotional health journey. And to individuals like that girl who took courage to step out and seek
Absolutely.
and take mental health professional aid without her
Hmm.
condition getting worse.
Without any stigma
And
also.
uh, right.
Yeah. So I can just say that I really feel blessed to be helping people, and that's what I really, feel that I'm meant to be doing this. So I'm happy that she came out, she has reached out to me, and if she's fine today, so that's what makes me feel happy too.
So now coming to the last section of our wonderful session that we are having today on anxiety. What are the interventions and treatment process that are applied for anxiety? You are please unmute.
Yeah. Can you hear me? I'm sorry, I was
Yeah.
on mute.
Now,
Okay.
yes.
So when we talk about, intervention, so there is required, one second. Okay, so when we start with any intervention, what is required is, which is very important, is that a person has to be starting with a foundational approach, right? Which is very necessary. So moving on to when we are talking about any thing which is going to give an intervention to a person, the foundational approach is starting with the case intake. That's the first thing. So what happens is that we start with the by talking with the person, wherein we take this case intake, we get to know that what the problem areas are, or what are the chief complaints of the person. Sorry. So in case intake, we at least get an idea. So we start and proceed with the counseling process that help us to make a connect with the person or the client. Also, the client can develop a faith in us. One second. I'm so sorry. Okay. Yeah. So the person develops a faith, and that's what we like to continue with. When there is a counseling session, there's a bond, the rapport building has been done, and now this lead us to go for a psychological assessment. So when we have taken the case intake, we have the little idea. Now after doing the counseling session, we reach to a point that now we need to assess. We have an idea about the concern, and now it is important to know that what is the intensity or level of that concern. So we go through that psychological assessment, which tells us or confirms us that what exactly is the thing and to what intensity, and that helps us for making a professional diagnosis, which confirms that the person is going through this and this. So, like any kind of a disorder. So when we formally, make a diagnosis, what happens is that help us to start with the intervention. And now, when we have gone through all the process, reaching to starting with the intervention stage. So, here we reach, now we are talking about anxiety disorder. So, anyone who's been diagnosed with anxiety disorder. So, every person, is different. So, no two individuals are alike. So here the approaches are supposed to be multiple. There is supposed to be wide range of things that can be used. The therapeutic sessions have to be with multiple approaches, right? So when I have to start with anything with a person or a patient who is undergoing anxiety, I start with CBT, because CBT is a kind of therapeutic thing which helps the person to change their negative thought patterns. So anything that develops or come into a person's mind is through a thought. So it's just one thought, and which is going to give you a lot many negative multiple thoughts, right? So here it's important to change the thought pattern of the person, what which is giving anxiety to the person. So when you work upon that, so now you're all sorted. So the person, during the therapeutic session, the client learn that what are their unwelcome thoughts, and which are supposed to be welcomed, and how they get trained during the session, that how they have to work upon their strengths, or they have to work more upon their weaknesses, which they need to eliminate, so that they may not have the fear anymore of anything which gives them anxiety. So entirely the negative thought patterns, the distorted thought patterns are being changed with the positive thought pattern. So that's what is being done in CBT. Also, when somebody is experiencing, anxiety, what I believe is, it's if somebody is instantly really going through the situation, to calm down the person, grounding technique is the best. Because what does happen is, in this grounding techniques, the focus is being shifted to five senses, instead of where the person is focusing and feeling anxious about a continuous worry the person is having. You need to take the person out of that situation. So how you can do? By just shifting the focus to multiple senses. It is letting the person to see something, to hear out something, to smell something, to think about the taste of something, or to experience a touch, right? So that shifts the focus entirely, makes the person calm, and their anxiety is being controlled. So another way could be, PMRT, which is again a relaxation therapy, progressive muscle relaxation therapy, we can say. In it what happened is that the person is being given this therapeutic session for more than 35 to 40 minutes, which calms down the person, which helps the person to completely feel rejuvenated, completely feel de-stressed, and completely feel relaxed. So why does this anxiety happen? It is because of there is a constant fear, or the worry or lingering thought a person is experiencing. So the person need to calm down and get rid of those thoughts. So PMRT help a lot, so that a person can feel great. And not only that, the art for therapy is also the best way or strategy, because I told you that multiple approach is always going to give you the higher rates of success, right? So what
Correct.
happened is, yeah, so by introducing the art therapy to the person, because in it is already an expressive therapy, where there are multiple art formation that can be sculpture, drawing, there are mandalas, there are lot many things that can be used, multiple approaches in art therapy also, so which
Correct.
can help the person to express themselves, whatever is giving them anxiety. They can, at least by performing those art formation, they can express themselves fully, and this is going to help them to feel at ease. And there are so many other approaches, and another what you can use is meditation and breathing technique is something that I suggest everyone to do, because that give wonders to a person. And if anyone wants to take benefit, or to know, or just experience that how does it help, so what you can do is, when you get up in the morning, do it for a 1 to 1.5 minute, and when you go back to sleep, do it for 1 or 1.5 minutes for 21 days continuously. See the difference in your life. Why? Because it is going to help you have a control in your thought process. So the only game of your negativity, to break that thing, is through having a great control in your thought process. So with the breathing technique, it becomes possible for you to really have a control back, and you can replace your negative thoughts into the positive ones. So these are the approaches that can be used, and that's what I use to help people or patients who are going through anxiety.
I unabashedly agree with you that is the eclectic approach that should be open and that should be implemented to take care and to treat and heal every mental health distortions. And here it's about anxiety. So I heartwarmingly thank you on behalf of our listeners and me personally for continuing with Disorder Dialogue Series 2022, which is definitely bringing a revolutionary impact towards the outlook in the mental and emotional well being of people and towards our mental health professional, that too globally.
I'm quite glad that maybe through these DD series which we have started, this is going to help people, because that is going to clarify a lot of things to people. Because when somebody is experiencing anything, they are not sure about what all symptoms are, and what they are
Correct.
experiencing. There has to be a a great or right understanding, so that they can start with the right thing. So I think that we by starting this journey, it is going to help many, and if it is going to help others, that's what is something that I always wished for. So I'm quite happy about it.
Yeah, I now firmly announce that this DD2 and Disorder Dialogue Series 2022 is beautifully impacting people's life and helping them to resolve and sort out their concerns. And it's all because of you, Doc, as one and only esteemed psychologist Anurada. So thank you so much for it. And is going to be continuing with the upcoming DTs for sure. So Stay tuned and stay connected with us, our admirers and our followers and listeners. So now, our official contact details will be visible on the screen to all of you, and you can be a valuable part of this revolution and of this impact with our Disorder Dialogue Series 2022. You can follow us, you can subscribe us on each of the platforms, each of the domains which are visible on the screen right now. And you can either note them down or you can take the screenshot of the same. Now, for availing a good mental health care professional services from anywhere globally, Psychologist Anuradha is working here worldwide. So you can book your session by going on our official website, which is www.goodmentalhealth.in, and our official mail ID is info@goodmentalhealth.in. And these two are both visible and highlighted on the top of the screen right now. So you can again take the screenshot or you can note them down. And anytime, if you want to avail good mental health care professional services, you are most welcome. And now we are going to be back with DD3 very
Mhm.
soon. And till then,
Yeah.
right now we are, yeah,
Yeah, so it was a great time, and I hope that it is going to give a great value to everyone. So, with this beautiful note,
indeed.
we would like to end up. So, everyone, thanks who joined, and
Thank
we'll
you
see
so
you the
much,
next
everybody.
time. Yeah,
And
and
thank you
thank
so
you
much,
very
Doc,
much.
for always being
So, yeah,
here.
okay, thank you.
We are signing off. Till then, have blissful days and have smiling days. Take care, everybody.
So, all right, bye bye, take care.
See you.